diagnosed with this condition 32 years ago, and I actually gave up smoking 30 years ago. And I know that physically my body is getting older, so it can't tolerate what it used to. And getting starved of the adequate supply of oxygen doesn't help a lot, you know. So the prognosis going forward, if you don't do anything, is not good.
When emphysema develops, the lungs are actually slowly and progressively getting destroyed. They remain in the same volume almost that they were when they were healthy, but this time now air shifts through the lungs, but it's not been utilized by the human body.
Day-to-day living is just a depressing thing. Everybody's worried, oh, you know, Dad can't do this, or, you know, and I want to be able to walk around my garden at home with my wife without having to go in a caddy cart or something like that.
If somebody obviously has to have a lung transplantation and it doesn't work, you cannot really go back and ask for your old lung to be put back in place. If you do have a lung volume reduction surgery, a keyhole surgery to have parts of the lung removed, and it doesn't really work, you cannot reverse that process.
One looks at the options of transplants, and that sounds all great. And if a donor came along with a good heart and lung, which I would need, because they tend to do both, why do you give it to a 68-year-old anyway?
Recently there is a new treatment that has been developed for emphysema. It allows patients to go back into daily activities much faster. This is called an endobronchial valve treatment of emphysema. The idea behind it in the philosophy is that if we can remove those areas or reduce their volume, then we will allow good breathing units to breathe better. If you have an endobronchial valve treatment, we can target those areas by simply occluding them with small valves that we insert with a general anesthetic or with sedation with a special telescope which is called a flexible bronchoscope. The procedure is fairly short. It requires a short length of stay in hospital, and it has a very low risk, and it also has a low number of complications. But if you have an endobronchial valve treatment and it proves that it is not so effective or it has created complications, then with a very easy procedure, those valves can be removed and the patient obviously will return back into the previous state of health that he or she was.
From a mental point of view, I'm quite prepared for what's going on. And I'm quite happy to judge it afterwards to say, wow, it's been good. Or else if it hasn't, okay, what have we lost? We haven't lost anything. Yeah, no, I'm excited. I'm apprehensive. Of course I am, but I'm excited, yeah. Exactly a month ago I had the operation. As it turned out, 4 valves went in and have effectively done the job. I'm using the bottom part of my lungs, which I don't think I was using before. The top part of my lung, the top right lobe, which has been neutralized with the valves, I believe has reduced in size and taken the pressure off the bottom part of my lungs. And in my learning to breathe by collapsing my shoulders and breathing from my stomach, it's got this part of my lungs going again and given them the room to function. Emphysema is a fatalistic thing. You can take a view and you can say, hell, I can do nothing about it. And by and large, that's true. Everybody tells you, you know, you've broken the skins of all these little bunches of grapes and you've got a granadilla. How can you make it a bunch of grapes again? How can you give it that surface area to absorb and get the oxygen into your bloodstream? You can't do it. So you can take a fatalistic view of it.
One question that arises from several people with emphysema is that if they do qualify to have the treatment with endobronchial valves, what should they expect and how soon should they expect an improvement of their symptoms? But as the process evolves and the symptoms improve, the rib cage and the muscles of the body improve as well.
There's less shortness of breath when he talks. less stopping between words and sentences.
I went to the top of the house
Yeah, one of the things on our bucket list, we each made a bucket list, was
First day in ICU, we made a bucket list.
Dad had to get upstairs to see. I said to Dad, right, on my list, you've got to get upstairs to see whose room? Charlie's.
Charlie's bedroom, yeah.
Dad made it up there yesterday.
Yesterday.
Without even stopping. Straight up, in fact, you and I were going, Dad, slow down, you know. And
they couldn't keep up.
The immediate effect of the endobronchial valve treatments is to reduce the volume of the sick lung, allowing the better lung to breathe easier and deeper.
Am I breathing in better? Yes, I do. I think I take in more air, so maybe I get 10% from that, and maybe I've got an extra 30% of good lung working in my favour. So, I think the prognosis going forward is very good, very good.
The endobronchial valve treatment is an additional bullet in the war and the fight against emphysema.